Hi everyone, my name is Nidhi Sharma. A lot of you know me already. Those of you who are new, I am a women's health physical therapist. I have been a therapist for about 12 years. I specialize in working with women before pregnancy, while they're trying to conceive, while they're pregnant, after giving birth. I work with women who have pelvic pain for different reasons, and I also work with men who have pelvic pain. I work with postmenopausal women who are leaking or having troubles in the pelvic region. So this is the 6th module. We have covered pretty much all of the pains. We have covered back pain, hip pain, leg pain, prolapse, incontinence, coming up to this point. And this would be the last module where I'll talk about pain. The next 2 modules will be more about exercising and preparing for childbirth and what to do right after childbirth. Okay, so if you have any questions, you can type and I'll come back to it later. So neck, upper back, and wrist pain during pregnancy. Neck and upper back pain is really not that well known in pregnancy, even though it's pretty common. Stats vary somewhere between 40 to 70% of women. So the lowest stat of 40% still pretty high. Usually happens in 2nd or 3rd trimester, can happen sooner also. The usual presentation will be one of these 3. There is dull, achy pain in the back of the neck, top of your shoulders. There is an achy pain in the top of your arm, or there is pain by the wrist or numbness and tingling in the hands. Numbness and tingling can be in all fingers or some fingers, or sometimes in the side of your forearm as well. So these are the most common complaints. Tingling and numbness typically happens in the morning. Upper back pain, neck pain can happen throughout the day, but again, upper back pain is more common in the morning when you wake up. So we'll talk about all of that. Now, upper back pain, neck pain, and arm numbness and tingling is not a new symptom. Like, it happens in all kinds of populations for all kinds of reasons. So I'm going to mention a little bit about why it happens in general population, but I'm going to really focus on why it happens in pregnant women, because there are specific reasons why it happens in pregnant women a little bit more, or in a specific pattern. So we're going to focus a little bit more on that. Okay, so causes of neck and upper back pain during pregnancy. If you have attended last presentation, I showed you this picture here of the pregnant woman. So one of the things we need to understand is the biggest and quickest changes in body are happening at pelvis and belly, right? So because the belly is getting bigger and the pelvis is loosening up, everything is loosening up, everything is changing, but because belly and pelvis are at the center of it, is where most changes are happening. Whenever we think about correcting posture or reducing swelling or doing anything, we should really think from the pelvis, because if you correct something above there, you stretch or you do exercises or you correct your posture just at your neck without thinking about your pelvis, the chances are it will not stay very well. You'll not hold that correction. So I'll keep coming back to pelvis in this presentation, not because you have pelvic pain or problems at your pelvis, but because more than likely the changes in your neck are a result of changes at your pelvis. So in the side view, you can see the baby's here. The baby's weight pulls the woman forward. So the center of mass shifts forward. Now, as the center of mass shifts forward, there's a pull on her lower back muscles and her lower back part of her spine. And if this was not compensated, what needs to happen is either the body needs to use a lot of muscle power to compensate for this pull, or she will fall forward, right? So either the body needs to create a lot of strength to fight this pull, Or sometimes, because spine is a flexible structure, what body does is this is being pulled forward, they're going to take the spine right above it and shift it back, right? So now there's a seesaw kind of a motion, and just because this is being pulled forward, you'll pull that back a little bit, and that's in a balance again. And that's easier way for the body to find a balance. So this is the most common thing that will happen in a pregnant woman. The lower back will shift forward, the part of the lower back will shift forward. Right above that, where your bra strap is, typically will have this leaning back. So you'll see this increased arch in the lower back. Now, of course, the spine doesn't end there. Spine goes even further up into the neck. So what will happen further up is, because this was going back, now this will come forward. So head comes forward, shoulder comes forward. Head and shoulder also come forward because the breast is getting heavier, right? So there is the weight of the breast starts increasing right from the first trimester, but really increases exponentially quickly as you approach the third trimester, 8th or 9th month. So the breast will pull forward, the belly will pull forward. So what you will do from the middle of the back is to sort of lean back and try to keep yourself upright. This is the most common pregnancy posture. What this ends up doing is, like you can see in this picture here, is rounding of the upper back. So upper back is rounded forward, the shoulders are rounded forward, and head sort of sticks forward. Now, head sticking forward, shoulder rounding forward, that happened or started in pregnancy, will continue after you give birth, because then you have a baby that you're carrying all the time, feeding all the time. The breast is still heavier, and now you also have a baby on top of the breast that's heavy. So it tends to just get reinforced further and further into the postpartum period. So that's first reason for pain. Second reason, increased weight of breast. I said that already. Swelling of hands and feet. It really happens a lot in third trimester in most women. Is your shoe size will increase, your feet are a little bit swollen, your hands are a little bit swollen. Not all the time, usually in the morning, or if you have been sitting or standing for a long time. Feet and hands tend to happen a lot in women who do desk work because they're sitting and the blood is being pooled down. The volume of blood in your body has increased anyways. Okay, from 4 to 5 liter, you have 6 to 7 liter of blood in your body. But also your blood vessels are loose, all the arteries a little bit looser, the blood pressure is a little bit lower. So all of those things combine to cause the blood to pool into the extremities, which is the hands and feet. And what this does is, if there's more fluid in my hands, there are small joints like wrist or ankle or thumb. If there's a little bit of swelling in these joints, there's pressure on the nerves and sensitive structures around these joints. So even a little bit of swelling can irritate those structures, because this joint doesn't have a lot of give to it, doesn't have a lot of buffer. It's not like hip that there's a little bit of swelling, it's not going to do anything. Because it's a thin joint, fairly flexible joint, a little bit of swelling can irritate the structures. And we'll talk about that a little bit later. Also, if you're sitting all day and your hands are heavy, what is that going to do to your shoulder? All your hands all the shoulders and the neck are taking the weight of your arms, right? So as you get pulled down, the neck and the shoulder will start to take more and more weight. Same thing will happen in the lower back. So two major problems we have to really monitor is, one is posture and one is swelling. Sleeping positions does matter, because again, you are a little bit looser, pelvis is looser, arms are heavier. When you sleep in a position where the arm is not supported, what it tends to do is tends to act like a free weight to pull on your spine. So like I can show you in this picture here, she's lying down and her breast and her arm is not really supported. Now the breast is heavier when you're pregnant. So the weight of the breast is gonna pull on this right side of her neck, and that can create pain on the right side, neck or shoulder. So we'll talk about it, how to support all your body parts. But what we want in pregnancy is, because there is more weight and there's looseness in the structures, we want to support arms and legs and spine as neutral as possible. Okay. So this is a typical pregnancy posture. I am 22 weeks pregnant here. My colleague is 32 weeks. So we're not that, you can see the different amounts of pregnancy here, but we still have similar posture. And that's what I was trying to say. As soon as you start to show, as soon as there is weight in the front, your body will start doing all those compensations above the belly and below the belly. So the compensation, usual compensation, like I said, was the arch in your back will increase, right? The pelvis is shifting forward, the belly is pulling it forward. Your upper back will sort of lean back. So you will lift this, if this breastbone, you will lift it up and then your head will come forward, okay? So this bone, chest bone, instead of facing forward, you will feel like the heart or the chest bone is facing slightly up. What that does is, as long as you're facing up, having this bone face up, you might feel like you're straight ahead. You might feel like you're looking straight ahead, but you actually leaned back. And if you lean back to still look straight, what you'll have to do is bring that head forward a little bit. So you have this forward head now. And we're going to try to correct all of those things. But like I said in the beginning, if you don't correct the pelvis, you can't correct the neck. You can't correct the head, because all the changes happen from the belly on, right? From the pelvis on. So we're going to try to correct from the pelvis and go up and see if we can correct. Okay, so rounded back and forward shoulder is the problem, but we're going to correct all the way from feet up so that your belly and your pelvis is corrected, and then hopefully you can maintain that correction up above at your neck and your head. All right, so these are the cues. You're going to stand, and you can practice this now if you want, or practice this later watching this video. It's not going to feel right in the beginning. Once you do it the first time, it's going to feel very awkward. And that's not because it's wrong. It's just because this is not the easiest thing. This is a new alignment for you. And the pregnancy is changing your alignment. Your weight is increasing every week. So when you start practicing this, it's going to feel very weird. It's going to feel like you're falling forward. Okay, and that's not true. You're not falling forward. You can look in the mirror and check, but it's going to take you some time to get used to it. And it's never going to be perfect. I'll talk about that in a minute. So standing here, I'm going to first soften my knees. I'm not bending my knees. I'm just unlocking my knees. Okay, so I'm going to unlock my knees. Then I'm going to roll my pelvis back, meaning I'm going to think about making my tailbone longer. Okay, so like there's a tail in the back, like it's getting longer. So I'm going to roll my pelvis back. Then I'm going to put my hands like this on my breastbone. And I'm going to pull that breastbone down a little bit, straight down to the floor. Okay, so remember I said that breastbone tends to face up, slightly up towards the corner of the wall instead of facing forward. So when we pull it down, you're going to feel like you're bending over, okay? You're just bending over, coming down from the upper back, not from the lower back. Then you're going to gently roll your shoulders back without letting this bone go up again. And then you're going to tuck your chin in. So we're going to watch it a couple of times. First, unlocking my knees. I'm going to put my hands on my pelvis, make your tailbone longer. Hands on the breastbone, pull the breastbone down, roll the shoulders back, and tuck your chin in. Now this position here, if you get to this position, you're going to feel like I'm falling forward. I'm so far forward, okay? And if you're very pregnant, if you're in third trimester, more than likely you cannot even get here, okay? Because there's so much weight in the front that your breastbone cannot come down quite as well. Practice as much as you can and as far as you can. If you feel like you're falling forward, stand right in front of a wall so you actually don't fall forward, or do less of the correction, but try to do it anyways, okay? Then hold this position for 5 to 7 seconds, let it go, practice again, 5 to 7 seconds, let it go. I'd like you to practice this 7 to 8 times in a day. Okay, this is not how you walk. This is not posture. This is not dynamic. You're not walking like this, but you are just reminding your body again and again that that back arch and rounded back is happening. And even though you cannot completely stop it, I'd like you to try to keep reminding your body to go back to a little bit to the neutral. So maybe you won't come back to perfect, or you won't be able to maintain the perfect, but if you keep practicing, hopefully you can maintain 50% of the perfect, and that's good enough, right? So if you were unchecked and you kept getting that arch in your back and you kept leaning back and kept rounding your back, you will have a lot of pain in your upper back and your arms. If you kept correcting, hopefully, even if you have a little bit of misalignment in your spine towards the end of pregnancy, it won't be as much that it causes pain. And that's our goal here, okay? Postural correction takes time. It's not a 1 or 2 day deal. And especially in pregnancy, it's a moving target, because by the time you get comfortable with one position, the position has changed because your belly has grown. Okay, so in regular practice, I teach this to a patient and they practice this for a few weeks and they get it. In pregnancy, you practice this and then it becomes a little bit harder. And then you practice it again and it gets a little bit harder. So you're constantly fighting that weight that's growing in the front and pulling you forward. Hopefully, sort of remember the principles and keep reminding your body to get as close to it as possible. Do not expect perfection, because you won't get it, more than likely. Okay, so one more time. We're gonna soften the knees. I'm gonna soften my knees. Hands on the pelvis. Roll your pelvis back, so make your tailbone longer. Both hands on the breastbone. You're gonna pull that bone down, straight down to the floor, maybe 2 inches. Roll your shoulders back and tuck your chin in, okay? If you try to roll your shoulders back without rolling your pelvis down, try it. You cannot hold it. Because if your pelvis is so far forward and you try to roll your shoulders back, you'll get that pain or tightness in the middle of your back. Okay, and that position you cannot hold. This position you might feel like you're falling forward, but it's not painful. That position will actually be painful. You will not be able to maintain it. Chin tuck, a little bit closer view here. Chin tuck is important because there are nerves in the back of your neck, okay, from this part of your neck that go down into your arms. So one of the reasons that you get arm numbness and tingling is irritation of these nerves close to your neck or your upper back. So tucking the chin in, especially if you're sitting in a chair doing office work all day, is so important, okay? If you're sitting down, you don't have to do the whole correction because your pelvis is already out of that forward tilt position. It's slightly tilted back. It's still helpful to roll your shoulders back a little bit before you do the head. It'll make it easier, okay? So take both hands, put it under your chin, or you can put it on your chin like this, okay? And then you're gonna make your double chin. So really push the chin straight back and think of making a double chin. At the same time, think of making the back of your neck longer, okay? So it's not compressive. We're not just going back. What we're doing is we're going back and making the back a little bit longer. So very little chin tuck is very little of a tuck, like going down, and then thinking of the back of the neck, like somebody's pulling the back of your head straight up like this. Somebody's making the back of your neck longer, okay? You'll feel the muscles in the front of your neck here, a little bit forward. Again, doesn't have to be 100%. Let's hope you can do 80%. Let's hope you can do 70%. It's more about how many times can you repeat it and how many times can you hold it rather than how far can you go. Okay, it's so important. We teach this to all neck patients, especially desk workers. They tend to be forward, but it's very important for moms because you are going to go forward all the time with the baby. Right? Baby's not going to come to you or look at you. So if your habit is to go forward, you'll just keep feeding into that habit when the baby comes. So we don't want you to be in that habit. Make that chin back, make that neck longer, and then move your entire body towards the baby rather than moving just the chin and the head. Positioning in bed. The simple logic of positioning in bed during pregnancy is support. Just support, support, support. Support as many things as you can, especially around spine. So there is no pull on the spine. When you are pregnant, your pelvis is bigger, it's looser. All the muscles in your body are a little bit looser. Things are a little bit heavier, right? So they will try to get pulled to, the spine will try to get pulled towards whatever is heavy. Your arms are heavy because they're swelling, your legs are heavy because they're swelling, your belly is obviously heavy, your breast is heavy. So if you don't support all the things that are heavy, those things will create a pull or tension on the spine during the night. And that's really the main reason for having more pain in the morning, which is common in pregnancy, more numbness in the morning, more achiness in the morning. So pillow between your legs, that pillow should go all the way from your groin to your ankle. Okay, so not just between your knees, all the way, the whole leg should be supported. And that pillow should be a little bit thicker and firmer because the legs are heavy. Okay, this pillow that she's hugging, I'd like this pillow to be even bigger, like a body pillow, so that the arm is slightly above her shoulder. So this part of the arm is slightly higher than the shoulder, so the swelling can reduce during the night. Okay, I also have a towel under the lower back, like in the small of her back, so that the belly doesn't pull forward. And then you're gonna have 1 to 2 pillows under your head. Okay, that's a hard one to show in the picture or tell you how many pillows you need, but we don't want, if this is your head and this is your neck, we don't want your head to be up and we don't want your head to be down. We want your head to be neutral, in line with your spine. Okay, so soft down pillow in the small of your neck and then a firm pillow underneath. You're gonna see how many you need. Usually 1.5 to 2 is what most people need if they're on their side. And more than likely you'll be on your side if you're pregnant. Okay, exercises. So there are 2 main principles of exercise in upper back pain. The front of the body, the chest, the upper back tends to, the front of the body, the chest and the breast area, the front of the arms tend to get tight because they get pulled forward. The back of your upper back, this area, middle of your back, tends to get weak. Okay, so the simple thing is we try to strengthen the shoulder blade area and we try to stretch, improve the flexibility of the chest area. Chest area and the front of the neck are also the areas where very important lymph channels are there. So lymph is one of the things that's going to increase the swelling in your hand. So if you're really tight in front of the neck and front of the chest muscles and your armpits, that could be one of the reasons that the hand swelling is not going away. When I talk about hand swelling later, I'll mention this again. It's not just about hands, right? It's the swelling is here. Obviously you have to get it out of your hands are swollen, but you really have to get that swelling all the way from your arm to your armpit, because most of the channels that are congested and causing the hand swelling are in your armpit, in the front of your arm and front of your neck. So all of this area, if you start working, stretching and improving mobility in this area, hopefully the hand swelling will go down by itself. Okay. All right. So exercises. Mobility is mostly we're gonna try to stretch the front of the body, and we're also going to try to improve the mobility of your upper back. These are exercises that I'm showing to a lot of range. Not a lot of women are able to do through all of this range. So if you're doing this exercise and you're hurting, I want you to stop. You have two options. You can skip that exercise, or you can do it partly. You can do it, through the, instead of going all the way back, see if you can go halfway and not hurt. What we want you to feel is a stiffness or movement in your upper back, or a stretch in your arms. But if you feel numbness or tingling in your hands, or if you actually feel actual pain in your neck, I want you to stop. Okay, so that's the first exercise, laying on the side, both hands together. And I'm going to take one hand and bring it all the way back. In this position, I should feel stretch in the front of my right arm, even in my left arm. I'll feel some stiffness or movement in my upper back. Okay, if you actually feel numbness or tingling in your hand in this position, I want you to not go as far, one option. The second option is to bend your elbows. So do the same motion, but instead of having the elbow straight, bend it and keep it bent as you go back. And that will decrease the tension on the nerve. Okay, so that's 1. 2. Start similarly. This one is tough if you have an old pre-existing shoulder injury. So if you have a shoulder injury, you can do half circle. You can go wherever you can go and then come back from there. Don't go through it, or you can skip it. Again, bending the elbow will make it a little bit easier. So this is called an arm circle. I'm trying to touch the floor on all edges and making a circle as big as possible. And then you're going to go from the other side, same exact thing. Typically, again, this is the range. This here is the range that either the shoulder can get pinchy, or there could be numbness or tingling in the hands. If there is, bend the elbow or don't go there. Okay. Third, hands and knees. If wrist pain is a problem, you can use the handles where you can hold on, or you can do this exercise on your wrists, on your fists. You can also go down on your elbows and do this exercise, okay? Or you can put your hands up on a stool where your hands are like this on the stool and do this exercise, okay? I'll talk about the wrist pain in a little bit. If there's pain in the wrist, which is a common thing in pregnancy, or there's a lot of swelling in the wrist, not a good idea to put direct pressure on the wrist. Okay, hand behind my back. And what I'm thinking about is, I'm thinking about twisting from my upper back. Okay, my head follows my hand in all of the exercises. Head follows the hand all the time. So wherever the hand goes, head looks at the hand at the same time. Okay, should feel good, should feel, even if it feels a little bit painful, it should feel good painful, not painful painful. Fourth is, this is simple cat cow that a lot of yoga videos do. And this is a good one to do. You can do it standing, putting hands on a chair or something. It's doable that way. And last one. Okay, you can use a foam roll for this. I tend to use a pillow with most pregnant women, because using a foam roller tends to put too much pressure on their belly. Like, it makes them arch too much. So usually a pillow, this pillow is a thick firm pillow, so not a soft pillow. You can roll up a big beach towel and use that. Okay, I have a yoga block here. You can have a pillow. Make sure that it's a firm pillow. And I'm going to lie down. My spine will be straight on that pillow. Keep your knees bent. Both arms are going to be on the side. And you're going to gently bring both arms up. The elbows and wrists are staying touching the floor. Okay. You should feel a stretch and a pull in your upper body, in the armpit and the front of your chest, sometimes even back of your arm, but it should not be pain. If you feel actual pain in your shoulder or back of your arm, don't go there, stop at that range. Or you can bend the knees. You can bend the knees, bend the elbows, sorry. You can bend the elbows generously, however much you need, to feel some stretch in the arm without feeling any pain in the shoulder or numbness in your hands. This is a tough one, especially if you're doing both of them together. Most women will tend to get some symptoms in your hand, like numbness or tingling. Stop there, don't go there. Don't go into that range. I think I was starting to feel some numbness right about there. So I bent my elbow. Okay. Strengthening. So all 5 of these exercises, we're going, the ones that we just did, improve the flexibility of your chest muscles, improve the flexibility of your arm muscles, and improve the flexibility of your upper back. Once we have done all of that, now to maintain this flexibility and to maintain rolling that shoulder back that we did, right, in the postural correction, we said roll your shoulders back, tuck your chin in. That rolling of shoulders back will only stay, you'll not only be able to maintain it, it will only become a habit if there is enough strength in your upper back and shoulder blade muscles. So upper back and shoulder blade muscles, again, there are tons of videos, tons of exercises that you can do. These are the 3 main exercises, easy, that you can do at home, okay? But there definitely are a lot more that you can do. I have a band here, a stretchy exercise band, any band will work. And I make a knot in it, put it over the door, close the door. And then I'm pulling both elbows towards my hip. I think that the space is not enough for me to pull all the way down. I'd like you to pull all the way down. So elbows to the hips. And the thought is pull those shoulder blades down towards your tailbone. That's my thought. That's what I'm thinking in my head, doing that. The second, standing there, pulling both shoulders back, pulling the elbows together. So squeezing your shoulder blade together. And I'm going to try, hopefully you can see from this picture, as I pull my shoulders back, I really try not to let this bone go up, right? The easier way is, as you pull the shoulders back, just arch your back or just lift up your breastbone. I'm really trying to keep my breastbone down, that correction we did in the posture section. Keep that breastbone down and pull your shoulders back. That's when you will really feel the pull, the work between the shoulder blade muscles, especially in this exercise, because it's easy to have the habit of just lifting up your chest bone, and we don't want that. And this is the last one. Very similar idea, pulling the arms back. We can also do this with bent elbow, and that will tend to be a little bit easier. Okay. All of these exercises are basically pulling the shoulder blades together, pulling the shoulder blades down, because those are the muscles that are going to help you stay upright. Whatever correction we did, don't roll your shoulders forward. You roll your shoulders back, but the only thing that will maintain that correction is when you start to strengthen those muscles around your shoulder blade. Carpal tunnel syndrome. Carpal tunnel syndrome is quite common in pregnancy. It may be a little bit overdiagnosed. Not every numbness, tingling in your hand is carpal tunnel, but it is, even with correct diagnosis, it's quite common in third trimester of pregnancy. Okay, so what is carpal tunnel? Carpal tunnel is actually a tunnel, a bony tunnel inside your wrist. So between the bones of your wrist, there is a small space through which a nerve passes. And that small space is called carpal tunnel. And the nerve that passes is the median nerve. What that nerve does is it comes from here, goes between those bones, and then comes into your hand and gives you feeling in some of your fingers. Like I said before, carpal tunnel happens for many different reasons in many different people, especially desk workers who sit like this all the time. But the main reason in pregnancy, almost all the time when we see the carpal tunnel in pregnant women, their wrist and their hand is swollen. Okay, so swelling or congestion of fluid around the hands, especially on the fist, is one of the main reasons for carpal tunnel syndrome in pregnancy. Okay, we're still going to correct the posture. We're still going to do all the things that we do in general carpal tunnel syndrome outside of pregnancy. But one of the major management factors that come into picture during pregnancy is swelling. Okay, so swelling crowds the structures in the tunnel, especially when combined with forceful or repetitive hand and finger movements. Okay, so if you're typing all day, or if you're sewing all day, if you're cooking all day, if you already have a baby and you're carrying that baby or toddler all day while you're pregnant, all of those things will increase the pressure. My case is in about 40% of women in third trimester. It tends to be worse in the morning, especially because the swelling is worse in the morning. Again, it's not what I see in clinical practice is not just carpal tunnel that's worse in the morning. There's a carpal tunnel irritation, but there's also irritation from back of the neck and the shoulder nerves that's causing the pain in the morning. So it's a combination of both, and that's why we have to manage both of them. Risk factors: obesity. Obese women tend to have more swelling. So again, important to manage your weight. Hypertension, especially diabetes-related hypertension, preeclampsia, where there is sudden swelling in the face, hands, and feet. That's one of the most common symptoms of preeclampsia, swelling. So that tends to cause hand pain or carpal tunnel. Varicose veins: if you have varicose veins during pregnancy elsewhere in your legs, in your perineum, you likely have some congestion in your hands as well. And diabetes because that's not gestational diabetes, that's general diabetes, which makes healing of the nerve tissue harder. Just generally, diabetes makes healing a little bit harder in body. So if you have diabetes, especially uncontrolled diabetes, it's important to work on that. It's important to work on that regardless during pregnancy, but also for this factor. Manage swelling. Okay, so like I said, all of that swelling that's in your hand is not just from your hand. A lot of it is coming from all of these structures that are tight. So all of the things we did in the past, where we were stretching these muscles in the front, improving mobility, and doing exercises to strengthen the back muscles, are going to help the swelling. Okay, so postural exercise, upper back and neck will help. During the day, if you can elevate your arms, if you're sitting or resting, if you can elevate your arms straight up above, so your hand is above your shoulder level, that will help bring some of the swelling down. You can talk to your doctor. There are also very thin gloves. So they're like stockings, but they're gloves that you can wear during the day, especially if you're doing desk work a lot, that will keep some of that swelling out. You can also wear that at night. Stress ball: if you have that squishy ball, keep it in your hand. More you use your hand and fingers, more are the chances that the muscles will act as pumps and will move the swelling out. Okay. Avoid excessive pressure on the elbow and do not sleep on your hand. So if you're sleeping like this all night, you're basically creating pressure. Okay, so have your hands straight. You can't elevate both hands if you're on your side. So if your right hand is worse in terms of pain, sleep on your left hand and keep the right hand above. So hug a pillow and make sure the right hand is above the shoulder level. Or if your left is worse, then sleep on the right side. So sleep on the other side to give the side. And if you have on both sides, well, do the one that is worse, basically. You stretches. So this is one of the most common stretch given for carpal tunnel. Basically, the front of your forearm muscles tend to get tight. You can massage these muscles. Take a rolling pin, put your hand on it and roll it back and forth, basically putting good amount of pressure in it. So these muscles will loosen up. So front of your forearm. Okay, and then pulling the hand back like this, only to the point of stretch without feeling a lot of numbness and tingling. So if you're feeling a lot of numbness, tingling, let the fingers go a little bit and just pull the hand. Okay, so keeping the fingers straight and pulling back is a stronger stretch than keeping the fingers bent and pulling just the hand. Okay, so see where you are, what is tolerable, and then do the one that is creating a stretch in the hand, but not actually giving you numbness and tingling while you do it. Okay, so roll this, ice this, stretch this, and hopefully you'll be able to stretch without any actual pain or actual numbness. Postural control. We have talked about posture before. We have done the exercises. More you pull this back, less chances of the nerve tension coming up. More than half the cases of carpal tunnel I see in the clinic is not just the nerve impingement here. It's nerve impingement here, but also nerve irritation here. So more you strengthen the upper back and correct your posture, you're going to solve half of the problem from here and other half from here. So I cannot emphasize this enough. If your wrist is hurting, don't just pay attention to your wrist, pay attention to your neck and your upper back. That's more important almost than paying attention to the wrist. Okay, desk ergonomics, keyboard and mouse pad, it's a long discussion. You know, we have with most, it's hard to show you in the picture what's the right posture is, but having one of those pads that will sit under your finger, under your wrist, and basically keep your wrist from going too far down or too far up. It should be more or less straight. Even with this, there's a good amount of pressure on the carpal tunnel. So your best bet is to take as many breaks as you can. Ice can help, especially at night before you go to bed, or keep ice by your bed and for the morning if you can use it right when you wake up. Night splints are sometimes needed. That is the night splint. It has a soft collar coming up to here that will keep your hand from going too far forward. Okay, it will keep your fingers straight and will keep some pull on the nerve, keep the nerve in a gentle stretch at night so it doesn't get caught on the tissue. There have been studies that yoga will help. The only thing, the reason the yoga helps is because it has a lot of upper back breathing exercises, right? So if you breathe properly and your upper back is mobile, flexibility will improve by itself. And that's what we need: more flexibility, more blood circulation, less swelling, less pain. Although we don't want the postures like this one where there's direct pressure on the wrist. We want to avoid those postures. There's tons of other things you can do, other exercises in yoga where there is no direct pressure on the wrist. So again, like all of the other modules, this is a good overview of why the pain happens. The most important thing to take away from this presentation is, okay, this kind of posture is what I should look out for. And this is how I should correct or try to correct so I don't go too far into that posture. These are the exercises that I should do to prevent these pains. Okay. I am not asking you to treat your carpal tunnel by yourself. That's likely not a good idea if you have a lot of pain in your hand. So these are preventative techniques, and they are somewhat treatment if it's very mild or it's just starting. Okay. Posture is going to solve a lot of other problems that are happening in your body or can happen during pregnancy. So pay a lot of attention to that postural drill and really do it all the time. I cannot emphasize it enough. Even if you feel like you fail all the time, like you can't hold that posture, you go back, it doesn't mean anything. Keep practicing it. Over a period of few weeks, you'll see that it will stick more and more. It'll get easier and easier. So that's the most important thing. But you actually have pain, go to physical therapy. Come to us. Now we can evaluate. Even though I can give you a lot of general guidelines, I don't know exactly your body. I don't know what has been in past, what kind of injury, what kind of posture you typically had in past. So when you come for physical therapy, we are a lot more specific. And then we can do manual therapy techniques that will actually relieve the pain almost instantly. And then the exercises become a lot more specific to your body. Okay. But this presentation is a good point to start to understand posture and upper back pain during pregnancy. All right, thank you.
Varicose vein. So is common happen during pregnancy?
It is, yeah.
And it goes away after the delivery, or it will stay?
So
Because,
it usually does improve. I can't say if it goes away. Perineal varicosities do typically go away because they're directly due to the pressure on the perineum.
okay.
But the varicosities that happen in legs and arms don't always go away. They will get better, but they don't always go away. I mean, it depends on the genetic structure of, your body a little bit. Breast varicosities also happen, and they also do stay for a while because of the weight.
Okay. Do you recommend to use like compression stocking, anything to prevent or not?
So compression stockings in pregnancy can be tricky,
Right.
because especially for legs, because they will create pulling near the pelvis, and increase sometimes is contraindicated if you have a high risk factor for preeclampsia, because it'll increase the pressure. So if you have a lot of swelling, you can use it. Most women can get away without wearing anything and just exercising and staying active. If you have to wear something, check with the doctor, because there are some cases where your blood pressure is slightly high and they won't allow you to do that.
Oh, I see. Yeah. Like exercise, like we typically recommend at hospital like this, like ankle pump kind of stuff.
For
Just
hands,
like
yes.
walking
I mean,
for the hand.
the ball is the easiest one. And for legs, I'll usually say buy one of those small bicycle, the foot
Oh, okay.
bicycle,
Yeah, yeah.
and put it under your desk, and then just sort of use it 10 minutes every hour.
Right. So,
And usually that'll work.
and same thing, right? Like sitting for a long time is not gonna good, and or standing for a long time is not gonna
Same
good.
exact thing. Like the upper back and chest region is the lymphatic sort of area for arms, that pelvis is for legs. So if your hips are constantly flexed and your pelvis is constantly taking weight, you will have more leg swelling.
Okay. If there is no question, we're gonna close the meeting.
Let me talk about next time.
Yes, please.
So next time I'll talk about which exercises, how should you exercise during pregnancy? I think we've talked about a lot of pain, aches and pains. And one of the things I see very common, especially in Asian cultures, like including Indian cultures, women are scared to exercise. They don't know what's okay for pregnancy. So we're going to talk about that because I think most pregnant women don't exercise enough. And it's not because they don't want to, it's just because they think it's not okay. So we're going to talk about what's safe during pregnancy, how much can you exercise, and how much should you exercise. And then I'll go, I think I'll be able to fit that in, and I'll go into the specific exercises or specific movements that you can practice for childbirth, especially if you're trying to have a vaginal birth, if that's your goal, then some of the things that you can do to help yourself attain that goal. So I'll combine those two topics.
Great.
All right.
Next time. I think June 24th, the same time, 9 p.m. Eastern time.
Yep. And if you already have a link here, you don't have to register again on Eventbrite. When I create a new link, you already have a link. I have your email. I'll send you the link again. And you already have it. You can just show up. So don't sign up again.
All right.
All right.
Have a good night.
Good night. Thanks, Yoe. Bye, everyone.
Have a good night, everybody.